Good morning, tribe. I just wanted to take some time to talk to Mary about her experience in the Neuro ICU. So glad you guys can join us, and make sure you enter your questions as you have them, and we'll see if Mary can answer those if we have time, okay? So good morning, Mary.
Good.
So you've been in the Neuro ICU, and is that where you started straight out of school?
Yes.
Okay.
It was actually my first job as after nursing school. So.
Okay. And so how long have you been in the Neuro ICU?
About 8 months. January would be my official first year.
Okay. So you've been off of orientation for a period of time. How long was your orientation period in the ICU?
The didactic was about 7 weeks, which was basically just theory. We would go over EKGs. We would go over titrations. We would have those type of things before we got onto the floor.
Wow.
We would actually have simulation lab where we would actually learn how to titrate and how to calculate the RAS and so forth for sedated patients and what have you. And then we go into more the preceptorship on the actual floor where we're assigned a preceptor, and that would last about another 8 maybe.
Okay.
So I didn't actually become on my own until January of this year.
That's great. So those 7 weeks of essentially like class time, is that standard for all ICU or just brand new nurses into the ICU?
So actually, this is actually part of a program called STAR RN, which there's several hospitals in Las Vegas that actually does the STAR RN program, which is a residency program for nursing students.
Okay.
For the regular floor, like med-surg and med-surg tele, they have just a program that will last about 7 weeks didactic, and I think also 6 to 7 of preceptorship on the floor. But for us critical care that are going into critical care, we get an extra week of didactic.
Okay. That's awesome. That's really great. I love that combination of learning. That's really good. Okay, so what did you do prior and how did it prepare you for the Neuro ICU? I think you've kind of answered that, but do you have anything you wanted to elaborate?
No, I was actually a business owner prior to being being a nurse. If you asked me about 5, 6 years ago if I was ever going to go into nursing, I would have probably said no. But I guess just life just took a turn and took me here. In terms of preparation, probably public relations.
Okay.
Knowing how to like deal with the patients, because in my head they're technically customers per se.
Sure.
So yeah, so in those terms, then I know how to deal with difficult patients. Okay. And we all have those in all areas of nursing, I'm sure.
Absolutely. So your business experience, I can imagine, really helped you in just like relating to your customers or your patients as it stands now. So when you decided to go to nursing school, was that just because of life events, or had you wanted to be a nurse previously and just decided you didn't want to go to school for nursing?
No. Even during the time that I had my business, the opportunity to go into nursing was literally knocking at my door, but it knocked on my door 3 times, and I didn't take it until the 3rd time.
Awesome.
Why? Probably because business was getting a little harder.
Okay.
And I had an experience where I had to take care of a family member who was going under chemo at that time. And a lot of the nurses were like showing me how to flush the lines and all that stuff. But I didn't get in there. They just showed me what they were doing. That was it. And I got interested in it. And then from there, I just said like maybe I can do this. And I started to look into nursing school. what will it take in terms of like prerequisites, how long it will take, and so I guess I just took the dive.
That's awesome. So do you feel like the Neuro ICU is a good place for a new grad to start? Why or why not?
ICU in general is hard for any new grad. A lot of seasoned nurses would prefer that you go to regular floors like med surg just to get your time management down and your routine down.
Sure.
But if the opportunity presented itself to be in a critical care position, there's nothing that you can't learn because every day you learn. Hard, but you learn.
Sure.
And the learning is much more intense than it was just a regular floor.
Yeah. So how was the experience being a new grad in the ICU? Do you have any insight or advice for future nurses coming into the Neuro ICU as a new grad?
Very tough. Experience-wise, during the first couple of months, being on the floor with even just a preceptor, and during the time that I was already on my own, it was very tough. A lot to learn. The first few weeks that you're on your own, you kind of second guess yourself. It's like, whoa, no one's watching me. I'm totally autonomous. I'm, executing all of the doctor's orders. No one's watching me. This is really surreal. It can be very overwhelming. I guess you just, especially with documentation, it does take a while to get used to, but you will get used to it. The most important thing is really just getting your routine down and your time management skills down.
Okay. So what are the top 3 things that scared you and how did you overcome them?
Not so much the 3 things, but more experiences that scared me. First was the blood transfusion because I felt the beginning they feel overwhelming.
Mm-hmm.
The blood, and then you have to flush the line and verify and stuff like that. And the beginning was very overwhelming, and after a while of practice, of course, you get used to it. But I always made sure that I had my charge nurse or some seasoned nurse with me because I felt at that time still very unsure of blood transfusions and how to go about doing them.
Mm-hmm.
The second one were art lines. Just because like the waveforms, like troubleshooting, just troubleshooting the entire thing. It was like you have to make sure that the waveform is correct, or at least it gives you the right clef for it. It was intimidating to me because I also had an experience of drawing blood from the art line. And the first time I drew blood from the art line, I did not know that I still had the adapter on it. And so like I pulled it off and the entire blood literally just splattered all over me. And a good thing I was smart enough to have an extra pair of scrubs, so I changed into.
Yeah.
Otherwise, I will never forget that experience because you'll learn with those bad experiences, and you know that you'll never do that again. So every time I draw blood the art line, I always make sure that adapter goes with it, not separately, but goes with it.
Yes.
Third one was a patient of mine that was experiencing bradycardia at that time, really, really bad. He was going into like 39, 37 of a heart rate, and I didn't know what to do. So I remember that because like I didn't feel that I did enough for that patient, and I took it really, really hard. And it was the first time that I cried because I felt that I didn't know what to do. We had the charge nurse finally just took over to help me, got the crash cart, and started putting the pads just in case we needed the cardioverter guy.
Sure.
But yeah, that was the 3 scariest experiences so far.
All right. But moral of the story in that case is that you're never, ever, ever going to know everything, right? We just need to know our resources and who we can reach out to.
Definitely. And especially with the charge nurses. Yep, and
Right.
definitely with the charge nurses that I had during that time was very, very supportive. And again, it's more of the emphasis of knowing your resources and make sure that you do have that support because you're not alone.
Right.
You shouldn't feel that you're alone.
Right. No
You
matter
know,
what
because
area you're in, right?
that's what the charge nurses are there for. They're there as a resource. They're there to help you because they know what to do.
Exactly. So what's been your biggest challenge so far?
Ah, probably having the confidence. That was always, I was, like I said, I was always hard on myself because there's things that I didn't know. And, it's more of learning that you won't know everything. You really won't. Again, it's just really having the confidence to learn from your mistakes. Having the
Yeah,
confidence that, yeah, I can actually get the hang of this and get to and really know it. So,
great advice. So, best advice for a nursing student interested in pursuing neuro?
mm, neuro wise, get your assessments down in terms of neuro because things can change really, really fast. I
Mm-hmm.
remember I had one particular patient. Um, the day nurse was telling me, "Oh, she's lethargic and she's her baseline is just like this, where like she just didn't know her name, her age, and what have you, because of the pain medications. And I had her for 3 nights straight, and I myself know her baseline. So what
Right.
she was telling me was kind of odd to me because by my shift, the pain medication would have already worn out. I
Right.
fall, it was so fast, and I followed my gut and just know that she wasn't right. So I told the charge nurse, we need to order a CT scan for my patient because she's really, really just not right.
Mm-hmm.
What do you know? Like when the CT scan um, results came back, she ended up having brain bleed. So again, it changes so fast. So know
Yeah.
your neuro is like down.
And you also trusted your gut, right? That's so
That's for sure.
important. Yeah,
Mm-hmm.
for sure. One of the viewers says, Denise says, you're never alone. As a new nurse, find someone you can trust so you can go ask questions. So I think that was her advice to new nurses in general, and all of us really. I mean, whether you're transferring to a new department or, trying something new, which some of us, all of us kind of get stagnant in our area and we're like, you know what? I want to try something new. I want to go to the bigger hospital. I want to go to a different area. Whatever that is, change is hard, and we're constantly learning, or you should be constantly learning. So, any
Mm-hmm.
insight for someone looking to transfer from a previous specialty into the neuro ICU?
Again, it's just really assessment, know your art lines, managing your ICPs. But I think most importantly, transferring to any unit, what's important is really knowing your support system.
Yes,
Having a mentor is actually really just as important too.
agreed. So, what are the characteristics that you think make a nurse successful in the neuro ICU?
Being organized, having a plan. So what I do, we actually have a brain sheet. I have a different one that I use in our unit. I'll actually show it to you. I have a blank one right here in front of me. So can you ever see it kind of?
Yeah.
All right.
Here, let me make you bigger so that they can see. There, go ahead.
Okay, so this is like basically our brain sheets. We write down the name of our patient. I just prefer using the last name, so it's not a violation of anything, and it still provides privacy. Have you age and what they came in for, the year, how old they are, if they're full code or they're limited code.
Mm-hmm.
They have the doctors, their pertinent histories. In this box, I use for neuro checks, how often we do their neuro checks. If they're alert, awake, and oriented, are they oriented only to person? Are they oriented to person, place, and time, and what have you?
Mm-hmm.
This one, if they're on room air, if they're using any oxygen treatment, if they're vented and what have you.
Mm-hmm.
Cardiac wise, I put down if they're normal sinus rhythm, if their sinus tacks, sinus Brady, if they had any incidents of VTACs or any run of VTACs, and if the doctor has any blood pressure parameters for the patient.
Mm-hmm.
GI wise, when I have a patient that's on tube feeding, how often are the, and if there's any water flushes for them.
Sure.
And then, like, of course, when uh, if they're on a Foley, if they're using the urinal or reassisting them to the bathroom, what have you.
Did you make that yourself, or is that something your unit or unit wide uses?
This one is just mine.
Okay.
I have an Excel sheet that I have
Mhm.
that I basically have a template that prints it out.
That's awesome.
Yeah, and then on this particular part, it's my eyes and it.
Great. So what's
and
your
at the back of
staffing
it-
ratio? Oh, sorry.
Yeah, and at the back of it, it's blank, and I organize by time of when they're due.
Okay. So you just use a blank piece of paper to do your med organization.
It's actually at the back of it. Which is
Yeah.
Yeah.
Okay. So what is your staffing ratio in the neuro ICU?
On a good day, on a good night, rather, is just 1 or 2 patients.
1 to 2. Okay. All right. Good. So let's see, where are we at in our questions? So what does a typical day look like? You answered that you have a 1 to 2 staffing ratio. Do you typically, what does your flow look like? Do you typically transfer in and out a lot in the ICU? Not typically, but anyways, what does a typical day look like in the neuro ICU?
Number 1 is coffee. I need my coffee just to be able to survive that tired night.
Yeah.
2, I get the report, know what's been done, needs to be done. If they have any procedures in the morning, whether or not they're going to PO for a procedure in the morning, if they're going to be with PT and OT this day, if there's going to be PT now, just stuff that important to know to continue the care.
Mm-hmm.
And then I just go to the computer for them, take a look at the order, and then I just organize it and get my assessments down first. And then I structure the care and then put together all the meds that need to be given to them. Like if I have medications that are 9 o'clock and 10 o'clock, I will give 9 and 10 o'clock at 9:30 so that I have that 30 minutes in between.
Great advice.
Yeah.
Good. So what is the coolest procedure that you've seen in the neuro ICU?
I've actually seen a craniotomy done in the room.
Wow.
And one of my first ones, and it's not that I almost, it just was surreal that I saw the actual drill being drilled into the patient's skull.
Yes.
That was the surgeon got green, and he handed me which he was going to put with drain, and I was like, there, take, gosh, oh my gosh. So like, this is surreal. So yeah, that was my first experience with craniotomy.
That's awesome. I've seen a bolt placed at the bedside, and that itself, I was like, oh my goodness.
Yeah.
That's very rare in the pediatric ICU. We don't see a whole lot of that. So what do you love most about the neuro ICU?
Just the learning of it. I mean, especially as a new grad, everything new pretty much excites you. And you have to, I guess in a way, you have to want to learn. It's really fun. after a certain procedure, sometimes I would sit at my desk and go through my little book and research a little bit more about it as to why it's being done and little tidbits that you have to know to watch out for
Mm-hmm.
the procedure.
That's great. Yeah, continuous learning. And do you foresee yourself in the ICU, neuro ICU long term, or do you plan to take this expertise elsewhere? I mean, I know this is really new to you, but do you foresee yourself staying in the neuro ICU for an extended period of time?
Honestly, no.
Okay.
I want to explore a little bit more. Neuro is very difficult, just because like everything can change in an instant.
Sure.
I'd like to actually experience more of a CTIC cardiovascular unit.
Okay.
Like to actually see surgical ICU also. But later on, give it a few years or so, I'd really like to dive into wound care, which is actually I really, really would like to be in wound care. Especially right now, like dealing with patients that are coming from long-term care
Uh-huh.
and else and sniff, and when they come to um, stage 4, stage 3, wounds, and I just really love being able to do things. A lot of my colleagues were like saying, "Why?"
Yeah, me too. Why?
Yeah, but they just like I don't know. I can't get it further, but I just really like wound care and someday I'd love to have my own wound care clinic, managing and treating these wounds. So.
That's awesome. I love that you're digging deep, you're expanding your knowledge, and you're able to, your sights are set on down the road. I think that's awesome, especially since you're a previous business owner. You have so much knowledge that you can carry with you to do that next phase of nursing that you've got your sights set on. I love that. One of the guests says there's lots of feedback on your end, Mary, but I think it's your connection isn't real good. Your internet connection, I think, is kind of choppy a little bit. And there's really nothing you can do about that, unfortunately. What are the hardest parts of being in the neuro ICU? You've kind of mentioned them here and there throughout our little Q&A, but do you have anything specific that you'd say is the hardest part?
Just really emphasizing on the fact that everything is changing fast.
Yeah.
Like 1 minute, the patient knows her name, her age, and where she is. Then the next thing you know, she doesn't know who she is, where she is, or what her name is. Can change that fast. And for you have to be able to know basics. You have to be able to read fast and who to go to be able to get an order. Hey, I need a CT. Like, we need to get this guy in. And
yeah.
Trust your gut. Know that something really is wrong and get them treated right away.
And really astute assessments, because we assess so quickly. It's not like you're doing a full head to toe every time you walk in the room, but you need to hone in on those things that are important in your area, and in specifically neuro. Doing those orientation checks pretty frequently while you're in there, it will really cue you in on something that's not quite right. Yeah.
Oh, yeah.
So just being astute with your assessment skills. I think that's a great point. Does anyone that's watching have any other questions before we end our Q&A so Mary can go to sleep? No other questions at this point, it doesn't look like. Okay. Well, Mary, thank you so much for giving us your time this morning. Thank you for working all night and then taking the time to chat with us before you go to sleep.
Yeah. Well, thank you for having me, and thank you so much for inviting me.
Yeah, of course. You have a good rest, okay?
All right. Thank you so much.
Bye.
Bye.